There are episodes where the stakes feel theoretical or methodological or even long-term. And there are episodes like today where the stakes feel painfully, urgently human. Around the world, we're seeing escalation in violence, where violence itself is used as a weapon of war, but also where accountability feels very fragile. We see that gender-based violence is increasingly visible, but at the same time remains one of the least discussed and least understood forms of harm. For me, this conversation feels very personal. Currently, the world is seeing my country, Sudan, endure large-scale violence and death, mass displacement, starvation as a weapon of war, sexual violence, and widespread atrocities, regardless of where you look. Conflicts like the one in Sudan and everywhere else do not end when the fighting ends. They continue to have large-scale physical, psychological, and intergenerational scars. However, the global systems that we use to look into to think about how can we hold people accountable usually struggle in seeing, naming, and often holding those responsible accountable. My guest today is Professor Kim Thuy Seelinger. She started her career in New York as a lawyer looking into cases of gender-based violence asylum into the United States. She then worked as an academic at UC Berkeley and at Washington University, where she ventured into looking international criminal law and where gender-based violence fits into international criminal law. And more recently, she actually worked with the International Criminal Court to try to really conceptualize as what we need to address gender-based violence in atrocities and war crimes. Right now, she's at Washington University School of Public Health, where she's trying to think about the intersection of public health and international criminal law. We discuss her work. We discuss what the international criminal law can do or cannot do in this fragile and volatile moment, and what tools we might be able to offer as public health professionals to try to understand these mass harms and the way we can respond to them globally. Welcome to the podcast.
Thanks for having me.
So I wanted to start first talking about your career. So you spent, I think, the first few decades of your career working at academic settings, UC Berkeley, coming to WashU, but then until recently also working at the International Criminal Court, working on gender-based violence or gender-based crimes. For those of us who are not clear what that means, what the law is, what does international law say about gender-based violence, can you walk us through what you did throughout your career when it comes to the topic of gender-based violence?
Sure. And maybe a small asterisk, Salma. I started out in practice as a lawyer, actually, so right out of law school. So I was representing, I was in New York City right after 9/11. So a lot of it was deportation defense against, just to protect Muslim men, Muslim immigrants. But I started on gender asylum work back there in New York in the early 2000s. Many folks who were coming to the U.S. fleeing persecution on account of their gender, including their sexual orientation, for example, or sexual violence they'd experienced in armed conflict back home. So I actually started out as a practitioner and just would spend 4 days a week just interviewing folks who had survived atrocities, really, because they were women or because they were married to a violent misogynist or because they were, a political opponent who was tortured in sort of sexualized ways in prison, for example. So that was my first work on these issues. And then when going to California after New York, I did have the opportunity to continue with direct representation, but in an academic setting. So that was working sort of more in the clinical context at the University of California at Hastings at the time, and then at Berkeley. Yeah. Berkeley in 2010 started in its Human Rights Center a sexual violence program, which I became the first director of. And that was where I was able to move more into the research and the policy world. And so that was looking at really the types of gender-based violence that occur in war and other types of armed conflict situations or humanitarian crises, And we just did multiple multi-country studies because it was a crew of us. Some of us were from law, some of us were public health, some were from sociology. And we did just interdisciplinary research on the way these crimes manifest, the impacts they have on survivors and their communities, and what those folks want from justice. And so some of the research looked at survivors' experience with the justice system, which then, of course, led to a lot of time in the Hague and other courts and national systems to understand, okay, of these tribunals that are trying to capture this crime as a war crime or crime against humanity or act of genocide, what does the legal side of it look like, and what does the human side of that experience look like? So not just how you would charge it and collect evidence and prosecute such a thing, but when people are brought into those systems because they've suffered, does that process make them whole? Does it hurt them in the process? Do they get what they want out of it? So in a way, with one hand, I was doing legal work as a lawyer, and the other hand, I was studying the systems and whether they deliver what they're supposed to deliver to survivors specifically, not just the International Justice Project writ large. So you mentioned going to the International Criminal Court, and that's true. So over, 10 years or so, I took more advisory roles within the UN High Commissioner for Refugees, or High Commissioner for Human Rights Office. I get to advise the Nobel Peace Prize Committee. So I was taking more of a global role in advising, even governments and our State Department. And part of that was I was appointed in 2021 to be the special advisor to the National Criminal Court prosecutor at the time. He's still the prosecutor, of course, but at the time I was just advisor to him. He appointed probably 12 people to advise him on specific thematic issues. And for me, the portfolio was sexual violence and conflict. And that was great because then I got to work with the teams a bit and help devise a new policy on these crimes for that office of the prosecutor at the International Criminal Court. And so one thing that we worked on was the 2023 revision of the office's policy on gender-based crimes. So I got to lead a lot of the conceptualization of that and worked with a couple of colleagues in the office to draft the practice parts. And that is the policy for that office, but then also all the national jurisdictions that choose to take that into their own systems because they're signatories. In 2023, I became a member of staff. Actually, I took 2 years of academic leave from WashU to join as senior coordinator for gender-based crimes and crimes against children at the Office of the Prosecutor, which means that you report to the deputy prosecutor and for some things to the prosecutor himself about, the support for the trial teams, for example, or if we now have a policy, what's the implementation plan, what kind of training, what kind of practice tools are necessary. So that was the work there. It was incredible work, and I'm sorry to leave it so soon, but I came back to WashU this summer. Yeah.
And you mentioned the 2023 policy that you worked on. So in preparation for this work, I asked you for some background reading.
Yes.
That was one of the background
readings.
What do you think? It was really eye-opening to read about the history. I think I want to start talking about some of the papers that you sent me, some of the documents. I think in 2000, Rhonda Copeland. Copeland. She had a really interesting lecture. First of all, that was mind-blowing to me, thinking about what is considered an international war crime, something that, especially when you have a gendered perspective to what is a crime versus not. So to me, first of all, that was fascinating. I thought, you never realize something that is so obvious to you, how long it took for it actually to become a reality. But another reading that you sent was also, I think, the Federation for Human Rights. They had a report in 2018. And then you sent the policy that you worked on in 2023. So just thinking about that history, first of all, I don't know if you have any reflections on that lecture. I highly recommend everyone read that lecture. I'll put it in the show notes. What is the progress we've seen in the past few decades, but also what remains to be a really hard barrier to tackle gender-based violence or gender-based crimes in international law?
Yeah. It's been a long road. Huh? I mean, on one hand, gender-based crimes and violence have been part of war since war itself, right? I mean, but it's always been treated as, incidental or just a natural consequence, right? There's a lot of boys will be boys mentality when you would see things like, rape or exploitation of women near a battle zone.
I
or
think-
sexualized torture.
Yeah, I think I was reading, the lecture said it was considered a humiliating or degrading act that affects the dignity, at least from World War II, the dignity of men or the country, but not necessarily a crime on its own. But yeah.
No, exactly. So it was always happening, right? Maybe not the same way to the same level by the same groups everywhere, but certainly has always been part and parcel of armed conflict because just that's how gender and power work when they feed into war too, right? But when it was raised at all, it was often with euphemistic language, right? Like this is a violation of family honor. It was never a violation about that individual person because of their gender or their place in society, right? It was a violation of family honor, or they would use language out of some of the war crimes, like structures and instruments about maybe an outrage on personal dignity, right? But it didn't get charged in a way that allowed someone to tell their full testimony and get reparation or anything, right? It was, if it was treated at all, it was quite simply this shameful act that happened, and then we're going to focus on killing and pillage, things like that, right? But we've seen a lot of progress. I mean, we had the Rome Statute and the establishment of the International Criminal Court, of course, but even before then, in the ad hoc tribunals, so the Rwanda and the former Yugoslavia, these two tribunals, we saw actually really sort of a lot of care taken to pay attention to gender-based crimes. And so we have some incredible jurisprudence that has come out, including acknowledging that men and boys can suffer gender-based crimes, including forced oral sex, things like this, and sexualized torture. And then out of the other tribunals that were sort of coming out around that same time, Cambodia, we have finally, many, many years later, after the conflict, the Khmer Rouge regime, we have some jurisprudence about forced marriage, which we also saw in a different way out of the Special Criminal Court that was in Sierra Leone, the Special Court for Sierra Leone. So you see different pieces of gender-based crimes coming out and being expressed in different tribunals. And this was hand in hand with sort of the feminist movement, international development work, and legal studies to acknowledge specifically like sexual acts. So you started seeing talk of SGBV, sexual and gender-based violence, right? To make sure that we weren't so fearful of stigma and taboo that we would ignore the uncomfortable truth that sexualized harm also happens. And then in the last couple of years, and you saw this with the 2023 policy, we made the decision to actually drop the S because in some ways it was separating and skewing a conversation away from the non-sexual forms of gender-based violence that are also occurring. And we decided to sort of reframe it conceptually and say, listen, we've got all these gendered forms of violence, much of which is sexual, and overlapping, but not coterminous with that, is also reproductive violence. And then there are other forms of gender-based violence that are neither sexual nor reproductive in nature or targeting reproductive function or autonomy. And they also should be included, right, under this umbrella of gender-based violence. So we tried to clarify what we saw as the relationship between those crimes. And then you see in the policy, taking those concepts, we then apply it to the Rome Statute that governs the work of the International Criminal Court and many of the signatory countries that are part of that system. So I'll pause there because maybe you had an additional question.
I think what are the areas that remain hardest to prosecute or even to think about conceptually international criminal law when it comes to gender-based violence or gender-based crimes? And do you engage with survivors, clinicians, advocates to think about why are those forms mostly not successful in international law?
Yeah, so some of the progress that we've made also shows you what some of the challenges have been and may continue to be, right? So in the last couple of years, in fact, sort of in the legacy of Rhonda Copeland, my colleague Lisa Davis at CUNY, has been a real just very helpful in articulating the crime of gender persecution, for example, which is really, it flows from human rights also. And so, it's where international criminal law and international human rights law converge because it is a crime at the core is about the severe deprivation of a fundamental human right against a group, some collectivity, for reasons, a couple of different reasons, including that of gender. So that is a crime that could be non-sexual and non-reproductive. So for example, we charged this in Afghanistan in the arrest warrants against the Taliban leaders, the deprivation and the denial of education for girls, right, which is a form of gender persecution, which is a crime against humanity. So in a way, one of the challenges has been there were some forms of harm that were invisible, and people like Lisa and many of the colleagues in the Office of the Prosecutor who were already working on gender persecution before that the gender persecution policy was produced in 2022, we were not seeing some of the relationship between conduct and histories and systems of oppression and discrimination over the years. And so that is starting to come to light through the crime of gender persecution. And there's a lot more work to be done on that. We just had a conviction, actually, our first conviction in the situation of Sudan at the International Criminal Court, where some of the gendered harm there, the gender persecution, was actually against men on account of gender and ethnicity. It was the killing, the separation and killing of 4 men because of their ethnicity and their, sort of their imputed political opinion or what they were doing, right? So you see that area growing. And we've made progress, right? Of course, now we acknowledge men, boys are targets. Also quite recently, and this is an area for more development, but acknowledgement of the specific experience of LGBTQI individuals and communities, like in Afghanistan, like in many parts of the world, and how that feeds into, and is often invisible because that data, that documentation is not there. Healthcare providers are not seeing folks, for example. So that is an area of emergence in the jurisprudence and the sort of legal understanding, but whether that evidence is forthcoming and easy to access is still quite a challenge. And then another area of growth that I think we've started on, but this is another area where I think healthcare providers are crucial, is starting to disentangle the experience of children from the experience of adults in armed conflict. Sometimes it's quite the same, right? Children suffer the same way adults do many of these crimes. A building falls down, kills everyone in it, or displacement affects everybody to some degree in the same way. And yet there are very unique challenges children face. Sometimes they're targeted because they are children, like child recruitment or denial of education, like we just talked about. And sometimes they have specific impacts that adults don't have, right? Yeah. Crime of starvation may affect an infant really differently than a 15-year-old and a 35-year-old because of their physical development or the cognitive effects it might have later in life. But then also sometimes children just have, because of their lack of autonomy often, they're less able to seek help and support and resources the same way an adult would. So if they're unaccompanied for some reason, in a course of armed conflict or displacement, they're less likely to get the help they need because it's harder for them to advocate for themselves. So in the office, we also have started to articulate this and think about the ethical and safe ways to account for the experiences of children more. But that needs a lot of care and a lot of expertise. And I think the health sector and healthcare providers are really a critical part of moving that forward and helping.
Yeah, and I think before we get to the health sectors and public health, because I do think that's really important, I'm assuming most of our listeners do not have a legal background. So just thinking about the realities that you just spoke about, can you help us understand how does the international criminal law recognize or categorize and ultimately resolve harms from different conflicts? For example, I think you've had a few sessions a few weeks ago that I really found educational for me, that you identified that there are different type of crimes that the international law thinks about. There are crimes of war, crimes against humanity, and acts of genocide. So for the untrained or people who are not familiar with legal language, what does that mean? How do you think about those different types of crimes?
Yeah, sure. So if this were live and we could sort of pull people's ideas of what they think the difference is, that's always really fun because people always have a good idea from what they read in the news and what they can piece together. But I'm happy to actually help distinguish a little bit. So when we talk about 3 main types of core international crimes. In the Rome Statute, there's also the crime of aggression, but it's still under development and we haven't been dealing with it thus far. But as you said, war crimes. So these would be crimes that are kind of what they sound like, right? They're committed in the context of an armed conflict. And that armed conflict could be international or non-international. And there's some variation between what would constitute an offense depending on the nature of the conflict. But essentially, these are crimes that occur with some relationship to an armed conflict. And then you've got crimes against humanity, which actually don't need an armed conflict. Often they overlap and they do arise in the course of armed conflict, but that's not a requirement at all. What is required is that the conduct you're talking about is part of a widespread or a systematic attack against the civilian population. And the perpetrator or perpetrators knew of that broader attack on the civilian population when they were committing the conduct in question. So for a crime against humanity, you could have a number of different types of offenses, but for them to be, meet the contextual elements of crime against humanity, you need that broader attack on the civilians. And there's no requirement as to numerosity, right? Or specifically what the systematicity looks like, but there does have to be something that shows that there's some organization or some method to it for it to be systematic, or that it affected a large number of people in a certain part of a region or a country. Under the Rome Statute for the International Criminal Court, there's an additional requirement that this be also some sort of related to some policy or organized in some way, but that's not the same for all tribunals. And then finally, we have the act of genocide, which again, an act could be an act of genocide and also a war crime and also a crime against humanity, but sometimes acts of genocide stand alone. And the key here is intent, right? This is what makes genocide quite difficult to prosecute, because while there are 5 categories of the type of harm that the conduct could be, so for example, killings of the member of a group, for example, or the deliberate infliction of conditions of life that are calculated to bring about the group's destruction, or imposing measures intended to prevent births within that group, or the transfer of children from one group to another, or causing serious bodily or mental harm. And any of those types of acts, if they're committed with the intent to destroy a group of people that are bound together because of their ethnicity, their race, or their religion, or their national origin, if those acts, any of those acts, are committed with intent to destroy that group in whole or in part, then it might be an act of genocide. And genocide's a little different than the war crime and the crimes of humanity because the intent requirement is so specific. It might be very easy to show that the killings or the violence took place, but you have to be able to exclude all other possible intents, right? You have to be able to show this was to destroy the group. It wasn't just to displace them, to move them, to punish them. You want to obliterate this group somehow. And that is what makes genocide specific, challenge sometimes.
And when you're so the distinction seems to be, especially when it comes to acts of genocide, requires a lot of discernment, a lot of investigations. So when you're at the ICC or when a prosecutor, the Office of Prosecutor is thinking about those different types of crimes, what is the threshold that you need to reach for any of those? Again, not necessarily only for lawyers, but people like me who are thinking, well, I look at the news, one thing seems very clear to me. I'm from Sudan, as you mentioned, and a lot of what is happening right now to me, I just look at what's happening in Al-Fashir, and I think immediately, this is from what I understand from the history of Sudan, from what I understand from what the statements, different warring parts are releasing, clearly, this is in a way an act of genocide, at least to me. What is required from you at the international level, or the international criminal law level, to say, yes, this might be the case for you as a local community, but it's not necessarily what is the threshold we need to prosecute a case?
There's the legal threshold question. So in that way, it's similar to in a domestic conflict. You have to prove something beyond a reasonable doubt, right? It has to be you have to be pretty certain that there's really no like it's quite clear that this is the reasoning for these acts and this is the right person. I think that the challenge in the international criminal law context, which is different than just international human rights law necessarily, is that you are under ICL looking at individual criminal responsibility. You have to name somebody. And it's one thing to prove what we call the crime base, like that these things happen. This many people died, this many people were raped, this happened in this place, this time period, and then show that it meets the contextual elements I was just telling you about for a war crime or crime against humanity or genocide. But the hard part, and where particularly a lot of gender-based crime charges struggle or are a challenge, is when you have an accused person, how do you prove really clearly that this person is responsible? Like, what's the nature of their responsibility for what happened? Often because the international criminal cases, at least at the ICC, because resources are limited and the jurisdiction is to really look at those most responsible, you're looking at at least, it was certainly high-level commanders, sometimes sitting heads of state, as we've seen, sometimes former heads of state. And so you have to be able to articulate how this high-level person is responsible for what happened in a village, on a field, in a detention facility that they may never have visited, never have been anywhere close, right? And so that piece is hard. That piece, it's not impossible, but you have to be like very creative. Sometimes you need insider witnesses. Sometimes you have cases of admission where they've said, this was our policy, we're going to do this. But, you have to piece that together. And that is often one of the challenges in being able to prove these types of cases. But we do it, right? It just takes time. And that's often not what's apparent, because often people say, this is so clear, look at what's happening in Al-Fasher, or look what's happening in Syria or wherever else. And it seems so obvious. Sometimes we feel like we know, say, genocide when we see it, right? But do you have enough evidence to show that this accused person had the requisite intent for that? And it may seem simple, but what you have to produce in court has to undergo like very, very high scrutiny from the judges. Because what you're saying is, we're proposing to deprive this person of their personal liberty for maybe 25 years, right? So in terms of rights of the accused, like you have to cross all of your T's and dot all your I's. What do they say? Especially for high-level folks, right? What do they say? You're gonna aim for the king, you better not miss, right? Like it would be a big deal, right? To charge someone who has a lot of power and then to lose on any of these charges, really. Because that puts your witnesses in danger after, that creates a lot of political instability also. So all of these crimes are, I think, we take with great sense of responsibility.
Yeah. So this actually brings me to, I think we discussed this before. So it's interesting to me that I always wonder, do you take the diplomatic/political aspect of thinking about all of those prosecutions in mind? And if that is the case, one side could be you would be very cautious about who you bring to justice. But I think the other side of it is that at the local level, we discussed this when al-Bashir, president of my country, who was, I think he had a warrant against him from the ICC.
Yeah.
When that happened, a lot of people in Sudan rallied behind him, despite of everything that's happening, because there is this view that the International Criminal Law, or ICC, usually just target African leaders or leaders in Latin America, but maybe in a way they're neo-colonial instead of focusing on crimes that are happening across the globe. Is that also a consideration? And also, what do you think about that perception?
Yeah, so first, do we take politics in mind? I think, and the prosecutor has said this repeatedly, and I think most people in the office really agree, is you have to follow the evidence, right? Politics and political winds are going to change over and over. You can't have an institution like the ICC just bend every time that it's sort of politically fragile, right? Yeah. To bring a charge. And you can't bring a charge, really, if the evidence isn't there. You kind of have to follow what the evidence says and where it leads you. And I think in principle, that is really the North Star for most of my colleagues there. I mean, that said, politics are real too, and they may complicate the work in that you don't get permission to enter a country. You can't just go in and conduct an investigation. You need the country to allow you on territory. And there are situations where we don't have access to territory. So then what are you going to do? You have to somehow do your investigation in other ways, right? You can't set foot on soil, but maybe there are other ways of learning what's happening there. So politics, I mean, affects the work in a really operational way sometimes. And you have to have the stomach for member states being upset sometimes that you're not taking their political needs into account. So that's way above my pay grade. I mean, I didn't have to do much of that negotiation. But to your second question, Salma, about the perception that the court, sort of a colonial experiment, I think it is very fair to point out that the first early phases of the court, most of the cases were concerning conflicts and situations in Africa. But I think what people, the casual observer, may not understand is most of those cases were referred to by people from those countries or the president of that country, right? And again, it's still complicated, right? Because if a sitting president refers the case to the court against their political opponents, right, that gives us access. Yeah. But it's also, there are obviously political dynamics at play there. So it's true. I mean, the first number of cases were very much, most of them started in Africa. Yeah. But that has changed significantly. If people are watching, they'll see in the last decade, there are situations open in Afghanistan, in Venezuela, right, Myanmar, Ukraine, Israel, Palestine. And so it's not just about Africa at all. And to understand also the way cases get there. States refer these cases for the most part. The state can refer its own situation, or other states, a community of states will say, prosecutor or judges, you need to look at this. Or it comes in from the Security Council, as in the case of Sudan, right? And sometimes the prosecutor can and has brought things proprio motu, like of their own initiative, but that's rare, right? Like that's not how it often is. So I think the perception that it's a court that only targets Africans, I understand where that perception came from. But if, like me, you work with human rights defenders in those countries in Africa and they are pushing with community support for accountability for completely unanswered crimes, it's more complicated than that. And when states refer, then, yeah, I think that's also part of the narrative that may not be that clear.
Yeah. So I would love to talk about the public health component, because I think I had a few conversations about the intersection of what you do and what we do in public health. And I think actually a good example would be some of the work you did in Tigray, because to me, when you presented it a few months ago, I was sitting in and thinking, this is public health work. This is really important work that relates to some of the public health work that we do. But I think when you were presenting it, you kept thinking, oh, might be an odd place to present this work to a public health audience. So it's just interesting to me to think, like, what do we frame as public health versus not? So we just started at WashU a few months ago, as did I. And I know you've been thinking a lot about what is the next step in integrating what you do in criminal international law, especially gender-based violence and crimes, and public health. Can you walk us through that Tigray case? I think a lot of listeners might actually agree with me. What you did there, a lot of it also relates to what we do in public health. But then what is your vision moving forward and what you want to do in public health and international criminal law, especially gender-based violence?
Yeah. I wish I had known you were going to ask that, because then I would have reviewed the work that we did, but it was a couple of years ago, but let me try to recap it. So we did that work. That was actually a request by the UK government, because it was at sort of the early stages of the conflict in northern Ethiopia. I don't know how much the listeners may know about the conflict.
I think, maybe give us some background.
Very, very briefly. So the northern part of, it's hard to summarize, but essentially there is an ethno-political conflict that broke out in the northern part of Ethiopia in the region of Tigray, and it sort of pitted the Ethiopian national security forces and army against the Tigrayan, an affiliation, an assortment of different Tigrayan forces because of long-standing ethnic divides and who has taken turns like in control of the country over the last couple of decades, actually. So the conflict started in the Tigray region, allegedly because of the TPLF, the Tigrayan forces' attack on the headquarters of the Ethiopian military, I believe, in Mekelle or near Mekelle. And so the Ethiopian forces responded, and over the course of, roughly 2 years, this violence was very, very close proximity, but also entailed eventually a humanitarian blockade of the Tigray region. And while this was ramping up, the UK government was trying to understand specifically, they were hearing reports of conflict-related sexual violence, but it was very hard to substantiate because there was lack of access, because of the conflict, the immobility of civilians, and the lack of communication with the healthcare system there. Tigray has, as many of your listeners probably know, has had an incredibly developed healthcare system, really kind of state-of-the-art doctors and facilities and just the system generally. And so this conflict broke the system because over, I'd say probably, and I'd have to pull the timeline up, but we were getting statistics from around the area and then some colleagues we had in Mekelle about how many hospitals were becoming non-functional, how many clinics were falling apart. And they actually had a specialized, the Eider Specialized Hospital, which has a lot of fistula repair, historically fistula repair, reproductive health care services, incredible facility, was rendered pretty much non-functional at the time. And the UK government was asking us to learn what we could about the forms of conflict-related sexual violence that were arising and who it was affecting, because they wanted to see what, is it true? These are sort of targeted on account of ethnicity, who was committing, and what were the unmet healthcare needs? What was this conflict doing in terms of people's ability to access healthcare? So we had planned to do that study in partnership with researchers at Mekelle University and at the Eider Specialized Hospital. And that was how we had written the study design. We got IRB for it. We were ready to go, and it seemed like an incredible team. And one of our WashU colleagues, Lewis Wall, he was at the medical school and arts and sciences. These are folks he had worked with for a very long time. But as we were ready to roll out, the conflict became so acute that our researcher colleagues said, we can't actually do this. We can barely leave our homes. We don't even have cell phone coverage half the time. And so you have to do it on your own. So then we had to switch and do everything sort of as open source as we could. What could we get from public sources, including news, English language news, French language news, what we could get out of Ethiopian news after we had gotten an Ethiopian colleague to assess what are the reliable independent news sources, right? Because everything could be owned by the state. It could be owned by, sort of Tigrayan advocates. We just wanted to know, what are we reading? Where does it come from? How do we measure and weigh what it's saying? So we had to switch to a really complex matrix of who's saying what about conflict-related sexual violence? What are they saying? How do we put that in how do we compare that and bring that into sort of an aggregate picture with the other bits of information we're getting? And it was from that's how we pulled together enough information to summarize what at least the public record was from multiple sources around the world and coming out of Ethiopia, and made recommendations, limited recommendations, but recommendations nonetheless to the UK government. And we were able to show certain patterns, right? And this is where the public health, I think, is so valuable. And we did what we could. It was a short, rapid assessment. We only had 6 months to do it. But what we were able to pull from the records that we could capture were patterns of the type of harm. It wasn't just rape, and I won't get graphic on your show, Salma, but the types of penetration by foreign objects and the things that were used as foreign objects that basically just destroyed women's genital regions and certainly would affect the reproductive capacity, joined with the things, the words people would say, the slurs about, Tigrayans or not being able to have any more Tigrayan babies, right? You start layering this, the medical piece with the qualitative, the wording that was used, right, in the context. So we had a lot of that type of reporting from folks who were there and were no longer on territory and so could speak to us. But then also we would see patterns of revenge attacks. So once the conflict spilled out of Tigray and the TPLF had moved into other regions, Amhar and Afar, then you see similar violence, but committed by Tigrayan forces saying, we're getting you back for what you did to my sister or my mother. Yeah. So it creates this second wave, and we could trace that over time. So I think, public health tools to show time series analysis, for example, like what Physicians for Human Rights did after the Kenyan post-election violence, for example. Yeah. That's another tool out of public health that is really quite useful. And then we were noticing things, we would hear reports of things that seemed really like mundane, bureaucratic things, and yet helped engender violence and create violence. So Addis is here, Addis Ababa is here, and Tigray is here, and there was, freezing of bank accounts. There were the way regulation of money affected the ability of headquarters for humanitarian services in Addis to pay their staff and their local teams to provide humanitarian relief and care up north was cut off. Mm-hmm. Same with communications. You just couldn't even direct or support the work there or know what was going on. So you have these really strange bureaucratic limits of money transfer. So you can't actually pay a staff, right? Or you can't buy medicine. And then you add to that the humanitarian blockade, which led to completely preventable deaths, right? Like no just none of the medicines you might need to fight off infection and so pregnant women trying to give birth by going into sepsis, for example, when that was easily preventable, or people who already had chronic disease, right, who couldn't get care. And so you just saw deaths that were downstream of hand-to-hand violence, but were completely preventable and yet happened because of the stranglehold on the healthcare system. And then we talked to doctors who described not only like sexual violence that their own residents and medical students suffered, right, on university grounds, but just the fact that they didn't have supplies, as I mentioned, but they also, because of the blockade, were starving. And so you hear accounts of doctors fainting in the operating theater, right, which is horrendous for them and the patient, but then also what that does to morale of the team around them and people's faith in what remnants of healthcare remain. So what we just saw complete devastation, and we did what we could to capture it then. Since then, Physicians for Human Rights has done a much more in-depth study where they had more time and things had calmed down enough, they had more access. So I'd really recommend their report is a much fuller exploration, and they did a huge mixed methods study, actually. So I think that if you look at their methods and then you look at what we were able to do in a limited way, you start to see not just the importance of the healthcare system, right, of course, which is probably obvious, but you start to see how different public health methods of research and analysis can help describe the breadth and the texture of a conflict. And this all goes to your question, which is like, this is critical for international human rights cases where you want to bring states to account for their failure to protect, or individuals who might be responsible under international criminal justice. Because part of what you're trying to show is not just what happened, but the scale of it, the impact of it, And lawyers, when we look at a statute and then the elements of crimes, you're trying to prove conduct. It's like a checklist of elements of a crime. If you do these 5 things, that equals this offense, maybe we'll charge it, right? But what isn't in those elements usually is the near term, the medium term, the long term impact.
Yeah.
Right? And we miss that. That's not often given enough space in the narrative. And then that becomes critical when you're trying to show, even at the beginning, to show that a case is admissible. This is the seriousness of what happened. And then at the tail end, at the ICC, in case of conviction, victims are entitled to reparations. So how do we know what they need for reparation unless we ask them? Maybe participatory methods help pull a lot of their needs. But then also sometimes people only know what they need right now.
Yeah.
And that may change over time, but still where they stand, they know what they need right now. If they don't know from the health literature that if this happens to you now, this type of sexual mutilation, this type of STI, this type of forced abortion, they may not know because they're not healthcare experts. They may not know that 15, 20, 30 years from now, this is the type of healthcare they're going to need. They can't ask for it now at the moment of reparation. So part of, I think, what really interests me is how do we understand what survivors and victims of these atrocity crimes want now for reparation, and how do we also give them information so they can telescope out to understand what they're also going to need when they're 30 years older, 40 years older.
Yeah. So then, so first of all, I think what you were describing reminded me of, I think, a call we were both on in Fasher, where it's clear also a lot of people were dying at the hospital because there was blockade and they couldn't get medication into the city, and that was before the actual massacre happened in Fasher. And I don't know if that is actually accounted for when people think about the atrocities that happen at war, because people were dying at the hospital just because they were not receiving medication. It also made me wonder if attacks on medical systems, is this new? I just keep hearing about this increasingly now, but I'm not sure if this was always part of the MO for war atrocities. I think, because I know you have to go, what is your vision then you're now at WashU, you're now at the School of Public Health, and you're thinking about the type of systematic evidence that public health would bring to international criminal law. First of all, what would you concretely need from someone like me who's an epidemiologist? But also, do you think there is increasingly more uptake or not of using this type of evidence in international criminal law? And if that's not the case, what would need to happen for those two fields to actually work more together?
Mm-hmm. Okay, yes. For the first question, I think attacks on civilian infrastructure is, that's generally understood as a war crime, and hospitals are supposed to be protected, right? So it is like a specific crime to attack hospitals. So we've had that in sort of the legal framework. And I think it's happened quite a bit over time, but you're right. Like we see a lot more strategic attacks on healthcare facilities now, and attacks on healthcare providers, right? Either to stop them from being able to deliver care in the targeted community, right? Or punish them because of perceived politics, because they work in a certain community maybe, or recruitment to then come in and work and care for specific combatants or specific detainees, just instrumentalizing them and their expertise. So we do have many examples of that, for sure. And there are some groups that have done really incredible mapping of attacks on healthcare infrastructure in particular. You're right that there's, I think, more attention to that. What do I need, or what do I envision? That's a long conversation, Salma, but I think it was really humbling to be in the belly of the beast, to spend time on staff with ICC colleagues, because folks, it gave me appreciation for how much they're juggling and how thinly stretched teams are, right? It's an immense work. And I think that there are things that an academic institution can do, not just with ICC, but for these cases are happening in national jurisdictions, or they're happening, there are fact-finding missions run by the UN, Office of the High Commissioner for Human Rights. Like we work with all of these folks, or I work with all these folks and always have. So there are questions that practitioners may have about health, for one thing, right? That they may not know where to go to find the answer. And a lot of those answers exist in the literature already, right? So one thing that I think, WashU, with its incredible School of Public Health and medical school, can certainly help with is I want to go and collate and survey and get the questions. I know what some of them might be, but I don't know all of them. And so I want to work with my colleagues, not just in The Hague, but in Geneva and in national systems, and see what are your health-related questions that will help you understand the context of where you're working, the crimes you're considering charging, the needs of the witnesses you're engaging who may have suffered certain violations. What are those questions? And then we categorize them, right? We classify them, and then we prioritize them based on what is urgent for them and what we think we can answer from the literature. And there's a bit of translation where we find it, like what does literature say? And then we can gather that knowledge. But that's not the end of it, because they're still not going to read the articles, right? They don't have the time, and it won't mean the same thing. Depending who's asking for what purpose, there is a translational piece. Take that. Does that need to be a checklist for an interviewer?
Yeah.
Does that need to be like a short 2-pager, starvation for lawyers, right? Like what is the tool that will guarantee uptake and utility and bring a much more holistic approach to the legal work? That's one thing. That's just like understanding health and health issues that are arising. But I think there's also some operational benefit and things that the healthcare sector and public health and medical science in particular can assist with. A lot of times investigators are working in contexts that they're not completely familiar with, right? They don't have the contacts. They may need to be able to build out referral pathways to make sure people that they're talking to or engaging have access to medical care or psychosocial support. Sometimes they have those contacts. Sometimes it helps. They need a little bit of help building that out. And we have those because we work with healthcare providers, right? You're a doctor from Sudan, like and I work in other places, right? So we have networks and resources that can be helpful, even just at an operational level. And so that's one thing. And then also I think the methods, as I said, I think throughout our conversation, there are methodologies that are either born of public health or completely natural in the world of public health that are quite foreign in the legal sector. So, the example that I gave earlier of when trying to understand a targeted community's priorities for reparation, we have methods, right? You do participatory research, you have a million ways, like consensus methodologies, whatever, to gather those priorities. They're much more sophisticated than how we as lawyers would know how to do it. But also in terms of like monitoring and evaluation, which we have so many experts here at WashU in public health, that's not something we as lawyers are trained to do. I know a bit about it because I've spent the last decade and a half sort of more in the social sciences and public health world, but when we write policies like the 2023 gender-based crimes policy, or the policy on children, or the policy on slavery crimes or environmental crimes, the intent is to implement them. But how we make sure, like how we know, are we doing what we said we would do? How do we do that process evaluation? And then are those steps having the impact that we had intended? How to do that impact evaluation? Like that is so critical. And I think a lot of tribunals haven't really had the internal capacity and the expertise to do that. And so a lot of partnership and support or advising can be quite valuable there. So I think those are some areas where a strong school of public health or public health experts elsewhere, we can provide a lot of support. And one other thing, sorry, I completely forgot about this, and it's sort of like central to the work. One of the areas of progress, Salma, has been in the last decade, really people getting on board with the importance of taking a survivor-centered and trauma-informed approach. All the intention is there, and everyone understands that at the level of abstraction. and sometimes you think, okay, that means be nice. It's obviously a lot more than that, right? And so how do we operationalize a trauma-informed approach in this work so we don't hurt people in the process, right? And so we've been working with colleagues at Stanford to sort of build out some of those tools. So I think that's just another area where if we understood trauma and the effects of trauma, as you've been studying, or human resilience even, right? That a lot of that lies in this field, and I think there are ways to bring that into the justice world too. I hope so.
Thank you, Kim. I know you have to go, but 2 quick questions.
Oh, yeah.
The first one is actually related to what you said about trauma. So what you do is come into contact with a lot of the most atrocious acts that a human being might face. And a lot of the time you speak or learn about what a survivor is going through, which you just mentioned. I don't want to ask, how do you cope? Because that seems like a simple question to ask, or too simple. But maybe thinking about what keeps you committed to continuing doing this work. You could have finished your assignment at ICC and have done something different. I assume, especially in the US as a lawyer, I assume there's a lot of things that you can do. Mm-hmm. But you choose to continue doing this work. So I guess I'm wondering what keeps you committed to this work.
Mm-hmm. I mean, it goes back. I mean, it sounds super corny, Salma, but I think one of the reasons it was so important to start out in practice representing survivors like every day for years is that it informs everything. It informs like how I think about policy, how you want to go about research. So I feel quite committed because once you've worked with folks who have survived things you can barely fathom, you have to do your part. And I think what is like really exciting for me is realizing as a lawyer, I have these tools, and law students, and they come up, they're super bright, they have a specific set of tools, and so you feel committed to bring those tools to the table, but that's never enough, right? We also need the tools from medicine and from social work and the historians, and so I feel committed to it because if we don't have all those tools on the table, we're going to miss something that somebody needs out of this justice process. And in a more concrete way, I'm finding, because I do, I have a bit of a foot in the law school here, and then we have incredible Brown School colleagues I've known over the last couple of years, and then now in public health. And I've worked with folks in arts and sciences. I know some of the folks in medicine. It is really exciting that there are so many faculty members and students from across both of our campuses who are interested in this and want to see what they can do. And so I feel like my role with the Center for Gender or Human Rights, Gender, and Migration, can we bring folks together and facilitate this? Can we create that community of folks interested in human rights work? I'm happy to do that. I have that space. You also have space. How do we bring this all together? And then build a machine that those out in the world who are doing this as practice know to come to us, right? That someone, we have to build that, because as you see in Al-Fashir and elsewhere, there's so much, it's overwhelming, the need for accountability and for care that these crises bring about. So we just do our part.
Yeah. And then our last question is, this is called Complicating the Narrative, and we're living in a world that is increasingly, just witnessing increasing violence and conflict across the globe. What do you think that is one narrative that needs to be complicated about global justice systems? I think you mentioned accountability. What would we need to change in public health, in criminal international law, given the world that we're living in right now?
What would we need to change?
Yeah.
I think there's the siloing effect that our disciplines have, right, is something that keeps me up a bit, because I think there is intention to work on the same issue, but how we break out, how we do truly holistic work together, the mechanisms are hard to find, and it's not always rewarded, right? And so I think just being a little more creative about learning from each other, right? How many times do lawyers and doctors and public health experts and social workers sit in a room and try to understand a problem together, right? We can't, like, it has to start there. It really has, and it's not that complicated, but we still don't do it, right? So I think that is one piece of it. And then I think I struggle with how to balance or how to work the tension between being survivor-centered and pushing for justice.
Yeah.
Because not everyone's on the same clock, right? And it may take someone a long time to be ready to come forward and disclose what happened to them. And yet you want accountability not to take 30 years as it does in some cases. So trying to figure out how to harmonize and align those stars is important too.
Kim, thank you so much for being here today and for all of your work.
Thanks, Salma. Thanks for having me.
This podcast was edited by Zach Leonaris and Catalina Melendez-Contreras. It is supported by the School of Public Health and Frick Initiative at Washington University in St. Louis. You can access this and other episodes wherever you get your podcast, or you can watch it on video on YouTube. Thank you for watching.